Hello, my viewer. Have you ever had or experienced a family or a mother who got a firstborn child and later on the subsequent or the following children or pregnancies were lost through miscarriages, through probably death immediately after birth? And have you ever thought about something that we learned, some of us, way back in biology, called the Rhesus factor? It could have been that is a contributing issue on the losses. And that is what brings us to this episode today and our sharing on Health Now Show, your health friend, with me, Jane Kariuki. And I have been looking at communities interacting with families, and I have come to realize that this is an area of concern to many families. And some of them struggle through it without knowing what is happening in their lives. And to share with us more information on this area that is critical in even as we go on and having children, God blessing us to have children, this area of Rhesus factor, how does it influence how we get our babies? And we are so blessed today, so blessed today to have a doctor with us. She's going to introduce herself on her area of specialization, which is related to what we are talking today. And that is the Rhesus factor in families and especially pregnancy and birth. And to take us through is Dr. Buga. She's going to continue from there, just introducing yourself and telling our viewers what you do on a day-to-day basis.
Yes.
And then you'll take us from there.
Okay.
Yes.
Thank you, Jane, for having me here. It's a delight to be here.
Yes.
Hello, viewers. My name is Dr. Margaret Nyakinywa Mbuga. I am an obstetrician gynecologist. I am working at Kiambu Medical Center. Been there for around 7 years now. It's a pleasure to be here, and it's also a pleasure to be walking you through the Rhesus factor and how it actually impacts on our pregnancies and the outcomes. I pray it will be simple enough for you to actually understand. Yes.
Yes. Asante sana daktari. Actually, it is true. When you say simple enough, it's because most of us, lay people, and we would want to really get all that information.
Yes.
And as you've put it,
yes,
simple enough.
Yes, simple.
And I believe that will really happen,
yes,
and it will be a worthwhile session for us.
Okay.
Now, let us start where it starts.
Yes.
How do we even get to form? How are the blood groups, let me call it that way,
yes,
formed?
Okay. So usually we have a broad classification of our blood group.
Yes.
The one that is universally known is what we call the ABO blood group.
Yes.
That means you are either blood group A, you can be blood group B, or blood group O.
Yes.
Or you can even be AB.
Okay.
These are traits that we actually inherit from our parents. So for example, if your mother is blood group A and your the father is blood group O, then you will have either blood group A or you'll have blood group O in that family.
Okay.
Then and it depends on how it is actually inherited. Yeah. And there's nothing wrong with whatever blood group you have.
Okay.
It is just nature.
So there's none that is superior.
There is none that is superior to the other. As long as it is just blood and it's doing what it's supposed to do.
Okay.
But then under the blood group ABO, we have a certain protein on our red blood cells that we call the Rhesus antigen. So this Rhesus antigen is what we either say, if you have it, it is positive. And if you don't have it, you're negative.
Oh.
So under the blood groups A, B, and O,
yes,
we also can call you A positive or A negative. You can be B positive or B negative. You can be AB positive, AB negative, or O positive or O negative, depending on whether you have the protein or not. And why is this important? It is important because then it determines what kind of blood can you receive. For example, if I am blood group negative, it means I do not have that rhesus factor. If I don't have it, then it means I cannot be transfused with blood that is positive. Positive means they have that rhesus factor, the antigen. That is what we call it.
Okay.
So if I am negative and you give me that blood that is positive, it means my body will view that as foreign. It's like a disease. So what will happen is my body will form antibodies to fight that particular rhesus factor or antigen. And that means I am negative, so I cannot be given positive blood.
Yeah.
And those are some of the issues that now we are about to tackle in terms of if the mother now is negative and she's carrying a positive child.
Okay.
Yeah. The other significance of your blood group, the ABO, also, I'm more skewed towards obstetrics.
No
but
worries.
It's
No
also
worries.
important because basically in terms of transfusions also.
Yes.
For example, the blood group O basically means they don't have the antigen. Allow me to call them antigens.
It's okay. It's okay.
So you either blood group A because you have an A antigen.
Yes.
Your blood group B because you have a B antigen.
antigen.
Or AB because you have both.
Yes.
Or O, you don't have any of the antigens. So meaning, if I am blood group O, you cannot give me AB because I don't have that antigen. So if you give me AB, it means my body will view that as foreign and it will form antibodies against that blood.
Oh.
If I am, say, A and you give me O, then it means the O blood does not have any antigens, right? That's why it's O.
That is
like zero.
Oh.
Yeah. So
right.
if I'm A and you give me O, then there won't be any reaction. And that is why we say all blood is a universal donor. Right?
You can give
anyone.
Yes.
But then remember, we also have the negative and the positive.
Yes.
So all negative can be given to anybody, but it is a rare blood group. All positive can be given to any other blood group that is positive, but not negative.
Okay.
Yes.
Okay.
I hope I have.
Ni masomo. Ni masomo.
Summarized.
Yeah, it's true. Yeah, I've had actually sometimes daktari calls for people to come and donate blood.
Yes.
Especially when somebody is in hospital.
Yes.
And I'm sure we'll get to that when we talk about women and mothers when they are delivering. And sometimes they call for I don't know, negative. Most of the time, the ones I've had, they talk about the negative. B negative, something like that.
Yes.
So it's like that. People need to be called probably a rare one or something.
So when you look at the rhesus factor, majority of people actually have the rhesus positive. So most blood groups will be whatever your blood group positive.
Yes, yes.
But the rare one is the negative.
Yes.
Beautiful thing about the negative is that it does not have the rhesus antigen. So most of the times it will cause no blood transfusion reaction.
Oh.
But we cannot say that what we want is just the negative. Remember, the majority of people also have positive blood.
Yes.
So it really doesn't matter. I feel like if it's all about transfusion, I feel like everyone who is capable of going to donate blood then should be in a position to go and donate. Yes.
Irrespective
of your blood group. It will help someone some.
Yes.
Yes.
Because it cuts across.
Yes.
There's somebody who benefits.
Yes,
from
there's
that.
somebody who's going to benefit.
Okay.
Yes.
Wow. Now let us go to the mothers.
Yes.
This mother is expectant. She doesn't know her blood group. She doesn't know. Let me just allow me to be using blood group
please,
for the sake of myself and others. And she gets her first baby. And what happens? Or probably you could take us through the pregnancy and how all this happens. Yeah.
All right. So the issue is only when the mother is negative.
Mm-hmm.
It doesn't matter whether the husband is. We focus on the mother.
Mm-hmm.
So you either inherit the negative status or the positive status from both parents.
Yes.
You can have two parents who are actually positive, but then they give birth to a baby who's negative. Because there's something we call homozygous and heterogeneous dominance of the blood, the D factor.
Mm-hmm.
So depending on how they are,
Yes.
if, for example, my father had a dominant D, I don't know whether you remember in biology, we used to write, if it's about height,
Yes.
we used to write capital T and
Yes.
small t. Do you
Yes.
remember anything
Something like
something
that.
something like
Kitabu
that.
sana.
Yes, I know.
Yes.
But just to summarize it,
Yeah.
yes, it is possible to have parents who are positive
Yes.
giving birth to a negative, is of negative blood group,
Yes.
and the father is of positive.
Mm-hmm.
There is a chance that she will get a baby who is negative.
Mm-hmm.
And if I am negative and my baby is negative, then there should be no issue.
Yes.
The problem comes in when the baby has inherited the Rhesus factor from the dad.
Yes.
And so I am negative and I am carrying a positive baby.
Mm-hmm.
So it's, what happens is throughout maybe the first pregnancy might not be an issue,
Mm-hmm.
but in case there's any bleeding that will occur in the pregnancy, or basically any bleeding, usually occurs from either I have a miscarriage, or maybe I had an ectopic pregnancy, or maybe I bled somewhere in between the line, right? Like either whether it was a first trimester bleed or a third trimester, any form of bleeding, and even delivery itself.
Mm-hmm.
There will be a bit of mixing between the baby's blood and my blood. Usually the placenta has a barrier, so we don't have that, mixing that happens.
Mm-hmm.
So, but in case that mixing happens, usually happens after the first baby has been born, during delivery.
Mm-hmm.
So when I get the baby's blood into my system and I am negative and the baby is positive, then I view that blood as foreign.
Yes.
So my body will develop antibodies, what we call soldiers,
Yes.
against that particular type
They'll
of
fight
blood.
this foreign object.
Yes.
Yes.
So they'll form antibodies against that kind of Rhesus positive blood.
Mm.
The thing is, once we form those soldiers, they stay in our bodies lifelong. And that is where the issue of consequent miscarriages will happen.
Yeah.
So the issue mostly comes with the second baby who is positive. If it is a negative, then I have no business fighting the baby.
Because muko sawa.
Tuko sawa.
Yes. Muko sawa.
But if the baby again has the father's blood group
Yes.
positive,
Yes.
remember we formed antibodies against.
Mm-hmm.
Initially, whatever is formed, and that's why the first baby does not have problems, is the first, we call them immunoglobulins.
Mm-hmm.
So we have two types. There's what we call M, and there's what we call G.
Mm-hmm.
M is what we form primarily after an exposure.
Mm-hmm.
Then once that is formed, it makes our immune system now to form what we call lifelong antibodies,
Mm-hmm.
which is now G.
Mm-hmm.
Those ones are tiny. So when I carry a second baby, now those can cross the placenta. So that's why now the second pregnancies and others
Yes.
will be affected.
Mm-hmm.
So in case there is any bleeding or anything like that, chances of now my blood mixing with this baby is very high, is high. If I already have the IgG antibodies already,
Mm-hmm.
right?
Mm-hmm.
So what happens is, once the baby is inside and we have the blood mixing, these antibodies will start attacking the baby's red blood cells. Now, the red blood cells, remember, are responsible for carrying oxygen.
Yes.
And they are they have hemoglobin, basically, and that hemoglobin is what will carry oxygen. For us to survive as human beings,
Mm-hmm.
all our organs,
Mm-hmm.
all our tissues actually need the oxygen.
Yes.
So if you have something destroying the red blood cells, it means then our tissues, our organs are not getting perfused with oxygen. So it means a failure in the baby's system, right? So we have severe forms, what we call hemolytic diseases, basically. So the biggest one being hydrops fetalis. Hydrops fetalis is basically the baby is still inside the womb, but the mother's blood antibodies have fought the baby's blood. So the red blood cells have been broken. There's no oxygenation. And the heart also needs oxygen for it to pump. So basically the pump fails. And when the pump fails, the pump is responsible for circulating fluid.
Yes.
So if your pump fails, then it means you have a lot of fluid being in the wrong spaces, under the skin, in the abdomen, everywhere. So you have a baby that is born that is very edematous. Edema just means fluid under the skin or fluid in compartments where it's not supposed to be. So babies are born with edema. Basically, that's the worst form. Okay. So most of those babies do not survive. Even so, they either die inside the abdomen, or they're born as stillbirths, or they actually do not survive. There's a milder form whereby after the baby is born, usually in nature sometimes is fair. Okay. Where you find when the red blood cells are being broken, then we form something called bilirubin. So bilirubin is what gives babies the yellow pigment. For example, a baby is born and you find the white part of the eye has become yellow. Under the tongue is yellow. The skin now turns to become yellow.
The jaundice,
that jaundice.
Yes.
So usually, for some babies, when the situation is not very bad, for some babies when they're still in the mother, that excess breakdown of red blood cells called bilirubin is absorbed by the mother, and the mother excretes that on behalf of the baby, which is a fairer condition, right?
Okay.
But now the problem is once the baby is born. Once the baby is born, then we have the baby's liver is immature to deal with that bilirubin. So it accumulates in the body and it's toxic to the baby. So when that happens, it can cross the blood-brain barrier. There's a barrier in our brains where it's just nature trying to protect us. Okay. So if it crosses there and gets into the brain, then you have brain damage, right? Something we call kernicterus, where the brain simply will not function normally. So these are conditions now after the baby is born. Okay. Right? Okay. That's why once the baby is born, one of the things we do for a Rhesus negative mother, we have to check what is the blood group of the baby, what are the bilirubin levels of the baby, how is the full hemogram, because we want to check the hemoglobin level, how is something we call the direct Combs test. Do we have the antibodies of the mother inside this baby? So in that way, we are able to tell how is, if the baby is positive, then we need to be a bit more cautious. There's a baby who will need to be admitted in the NBU for follow-up and checking.
The newborn unit.
Yes, the newborn unit.
Yes.
So the other condition is where the baby just develops a form of anemia later, after the baby is born, because there is a slight breakdown of the hemoglobin, of the red blood cells, So when that happens, of course, again, newborn unit needs to be reviewed. So if you see your baby is turning yellow and, I think this is a baby that needs to be checked by the pediatrician or a neonatologist. Yes.
I've had something probably that is outside here, but I've heard that if a baby has jaundice, you take that baby out in the morning.
Yes.
When the sun is not that hot.
Yes.
I don't know whether this is true. Those are things that we hear in the communities.
Yes.
So that child can get the sun, the early sun, and then that jaundice goes. I don't know how true that is.
It is true. So there are different causes of jaundice. Of course, here we are skewed because we know we are dealing with a recessive negative.
It's true. That's why I've said it's outside what we are talking about.
It is true. There's something we call physiological jaundice that actually develops. And one of the treatment is actually to take the baby out in the sun.
Oh,
okay. Yes, it's a way of preventing and also a way of curing. But if you find that your baby is turning yellow, then do not take the baby out to the sun and self-medicate, because I think it would need to come from a pediatrician
Yes.
who checks the bilirubin levels.
Mhm.
There are bilirubin levels that might just need the sun,
Yes.
and there are those levels that will need actually phototherapy
Okay.
and more advanced care.
Okay.
Yes.
Okay. So when we are there, when our child is born, our baby is born, and you are doing all these tests and you are doing all this care.
Yes.
You know, I've had some mothers say that daktari insist na kufanya all these tests at all this care, and the baby care was so much money, and I'm now coming to even think about that it is for the baby, for the welfare of the baby and the mother.
Yes.
Because if we don't start there, then that means we don't know the progression, how the person goes, and even how the baby grows. So I think that is something that we could just tell our viewers that it is important, even when the baby is being taken care of, even immediately after birth.
Yes.
For this particular area that we are talking about.
Yes.
Yeah.
It is very crucial for a Rhesus negative mother to actually go home with a baby who is going to survive.
Yeah.
So once the baby is born, it is always good to have that checked. If your baby is blood group negative, then there's no need to worry. If your baby is now blood group positive, that is where the problem sets in. Not all babies will react this way, but majority will have a bit, there will be an impact.
Yeah.
So it is always good to have it checked. And besides, prevention is better than cure.
Yeah.
The earlier we intervene, the better it is in terms of prognosis of this baby.
Okay.
Yes. So now, in a way of preventing all these things from forming, it is good for mothers to actually go for antenatal care early.
Okay.
Unfortunately, we have a culture of going to hospital at 5 months of pregnancy.
I had Dr. Mary talk about that. I was like, I don't know who tells people that they should go at 5 months.
I don't know why people believe that if you don't have a problem, then there's no need to see a doctor. Well, we are here.
True.
Yeah, and part of why you should see us is what we call preconception care. So preconception care is where we assess you. We assess your risk in terms of developing complications in pregnancy. And at this point is when we would want to know what kind of blood group do you have, how many miscarriages have you had any stillbirths, have you had any babies die inside your womb, have you had any congenital abnormalities, from other babies that you had given birth to. So we categorize you, what we call risk stratification, if you put it that way. Yes. And once you conceive, then if you had not known what your blood group is, then it's part of our antenatal profile, so that we know what kind of blood group are you. Now, majority of our women don't even know the blood groups of their husbands.
True.
Which I would recommend. There's nothing, it's not painful. It's just we take a little bit of blood and do, it's you don't need to be prepared. It's just something you walk into a lab, you say, I would want to know my blood group. I don't even think it takes more than 10 minutes. Even 10 minutes is overstretching.
It doesn't. I've done it.
It isn't. And it's not painful.
It is
right?
not. It is not.
So there's no harm in knowing what your blood group is, because now if we know that you're negative and your spouse is positive, then we will start instituting care early. For example, say you have a bleed or something in your first trimester. So there is what we call an indirect Coombs test. Indirect Coombs test is basically telling us whether you have formed antibodies against the fetus, right? So it is a test that is necessary for any mother who is gravid, who is pregnant.
Yes.
Right.
Yes.
So we usually do it at first contact, and if there's no issue with
5 months,
it's very unfortunate, yeah. But if we could do it around 12 weeks, even better. Then we repeat it again at around 28 weeks, right? Because at 28 weeks is where we start seeing now the mixing of blood happening. So we do it at contact and we do it again at 28 weeks. If it is negative, then it means you don't have the antibodies that will fight the baby. So at this point, you will benefit from something we call an anti-D. Anti-D is an injection that you get that prevents you from forming those antibodies against your baby.
That is in the first
No.
baby.
So yes,
Are we in
whether
the first
it's
baby?
the first baby or the others, we do it as routine.
Oh,
So we
okay.
first do the ICT test to check whether you're negative or positive.
Yes.
It's a good thing if it is negative.
Okay.
If it is negative, it means you have not developed the antibodies,
Yes.
right?
Yes.
So we continue again, unless something happens like bleeding that occurs or a miscarriage or something. That is the only time we'd get to give you the anti-D beforehand. But routine, once you hit 28 weeks, we repeat another ICT. If you are negative, it means you are still safe, so we give you the anti-D to protect you.
Okay.
Right?
Yes.
So usually from around 28 weeks, if we stretch it so much, well, can give it up to 32. But ideally, 28 is the best time. Then we say
28 is usually around 7 months.
yes.
Yes.
So we say it stays in the system until for a period of like 12 weeks. So by the time you're hitting 40 weeks, maybe you should be planning with your doctor about delivery. Right? Now, once you deliver, we check the blood group of the baby. If it is positive, again, we give you the anti-D within 72 hours of delivery. So in this case, we'll give you twice, unless you had a complication earlier.
Okay.
Yes. So that is prevention, basically,
Yes.
for those who are Rhesus negative.
Yes.
Now, unfortunately, there are those who, for example, later you did not get the anti-D, or you didn't know, or, something somewhere, you got sensitized, and you happen to be Rhesus, you got iso-immunized. What that means is, I do the indirect Holmes test, and I find it is positive. Then there's no benefit of giving you the anti-D, because you've already formed the antibodies. So in this case, it does not mean doom for your pregnancy,
almost,
right? No, it doesn't mean doom. Well, it just means we need to take you to a facility where you can be managed better. This would be a tertiary hospital like Kenyatta National Hospital, a place where they can be able to follow up your baby. So ideally, they would check how your antibodies are behaving. Are they rising? Basically, the antibodies against the baby.
Yes.
Are they rising? Is the baby affected? Has the baby managed? Has the baby system been affected? Maybe they are now having anemia. Maybe even the bilirubin levels are too high. And there are interventions for it too, right? There's transfusion that can be done when the baby is still in the womb, right?
There's hope.
Yes, there's scans that they can do to actually monitor. They can monitor your antibody levels as the mother, because all this, remember, it does not affect the mother much. It's all about her baby, right? So if you're in a center where we have like a fetal maternal expert, this is what we do, and there is hope. Yes, there's actually hope.
Yes, hope.
Yes. Though we don't want to get to that.
We don't want to
The
get
best
there.
thing is to prevent it,
Yes.
because it can be quite time consuming and expensive. This is something that you can actually prevent by knowing your blood group, doing an ICT. Is it negative? Get your anti-D at 28 weeks, get it again after birth if your baby is positive.
Yes.
Right? There is no death sentence, and as I said, there is no superior blood group to the other.
Yes.
So whether you're negative or you're positive,
Yes.
the blood is functioning the way it's supposed to, right?
True.
It doesn't really matter.
Yeah.
The only issue comes in now when it comes to obstetrics matters. And remember, when it comes to obstetric issues, then it's only the mother that is the determining factor.
So if I was the negative one.
Yes, if you are the negative one, now
Yes.
that is where our concern would be.
Yes.
Because you see, your husband's blood has the positive, the D antigen, the Rhesus factor.
Yes.
So if you don't have it and you carry a baby that has it,
Yes.
now that is where the issue comes in. But if your husband is negative and like in your situation, you're positive,
Yes.
then there is nothing. He's giving you a baby. Let's say the baby now is negative.
Yes.
This baby has no antigen for you to fight back. You get what I mean, right? So it is a good thing if your blood group positive.
Yes.
It means then this doesn't apply to you. Yeah. So basically, it's good to know your blood group.
Yes.
So that we can actually prevent some of these issues before they actually occur. And It's always good to know your blood group. Why?
Yes.
You might be in a situation where you need blood urgently,
Yes.
right?
Yes.
Of course, the hospital has to cross-match your blood, meaning they take your blood, they check what blood group, then they cross-match with whatever blood is available, and they see what blood is there.
Yeah.
And then it's always good to be generous. You might not have an issue today, but a relative somewhere will need the blood. For example, in our obstetric units, you know, we tend to get a bit of bleeding after the mother has delivered once in a while. So, and what saves the mother's lives is the blood that we get. So I would encourage people who are of age, and if you don't have any comorbidities that prevent you from donating blood, to just check into a blood donation unit and go ahead and give your blood.
Probably people
Let's
fear
be generous.
that the now diseases that somebody may have, like people fear to go and donate blood.
Well, I would look at it in a different way. That if
Some
I
people
donate,
just fear. Some just feel because I may be discovered I have this. I may be discovered I have this.
wouldn't it be a good thing if they discover and you will start on treatment for whatever it is?
Sometimes people say,
Or what
"What
you
I
know."
don't know." Not hurt me.
Oh dear.
No, that's people just say like that.
Yeah.
What I don't know, not hurt me. But actually, it does.
It's
whether
actually
whether you know it or
beneficial.
not,
Yes.
it will still hurt you.
One day you will still discover.
Yes.
So the earlier the better.
The earlier the better. Yes.
Yeah. I feel we had covered about how to prevent.
Yes.
We've covered about the consequences of you know, there being rhesus isoimmunization, meaning the mother has formed the antibodies against. We
Yes.
said mostly it's to the baby,
Yes.
right? So you can have problems inside the womb, or you can have problems after the baby is born. Well, after the baby is born, also we have treatment
Okay.
where the neonatologist, pediatrician will be assessing the levels of bilirubin that are in the system. Then if they notice they are rising or depending on a certain point,
Yeah.
that's when we give treatment as phototherapy. So phototherapy is the blue light. So how it works is that it changes that bilirubin to become something that is less
So
toxic.
the baby is put under the
Yes, under the blue light.
Yeah, Dr. Are there other challenges that, apart from the miscarriages, which are very, very key, happens to this mother? Are there other challenges that this mother experiences or this family experiences during other subsequent pregnancies?
Yes.
Yeah.
So let me start with the mother because she's our primary focus.
Yes.
So as we said, mostly the firstborn, really there is no problem. The problem is when you have the other pregnancies from number 2 going henceforth, if at all they're rhesus positive. So most of the times a mother will experience a bad obstetric history where you have 2 or more miscarriages that are happening, or you have, you know, stillbirths. You give birth and the baby simply is dead by the time you're giving birth, or the baby actually dies within the womb. Some are born but they die within days of being born because, you know, of the breakdown of the red blood cells. So yes, it's a very trying time for the mother because, you know, one miscarriage for a woman is one too many.
It's a loss. It's a
It
major
is a
loss.
loss.
Yeah.
Sometimes the people around her don't actually get it, but even a loss of a 8-week baby and a loss of a 20-week, of course, the one with the 20-week might grieve more because you are able to do a scan, you saw your baby playing, you know, versus the 8-week one. But it doesn't matter. A loss is a loss.
It's a loss.
So, and it can actually impact on her obstetric history, like being afraid. You can imagine then if you lose 2 subsequent pregnancies, and especially if they were big. You can imagine you've carried a baby 7 months, people have seen you pregnant, and you know how sometimes I would use the word shameless. Kwani ulizaa? What is the baby? Yeah.
Did you get a boy or a girl?
Exactly.
Yeah.
And people have no bad intentions, but it's actually very insensitive. Sometimes you don't think about that, and that has a lot of bearing on the woman's psychological well-being.
Sure.
So I would say that they need a lot of psychological support. If you happen to get a loss, then it would be good to have a psychologist just review you. You need a strong family support system. And unfortunately, the biggest support system most people will get is their spouses.
Yes.
Right?
Mhm.
And in this part of Africa where our men are, it's a patriarchal community, well, I would say maybe our men need to be a bit more caring. Of course, many are, but it's good for them to know that they are the primary support of the lady. So they should be there, the family support, whoever is able to come and, grieve with her, whoever is able to come and support her, encourage her. Because remember, there's still a chance that she can carry a negative baby like herself.
Yes.
Yes.
I met another woman as I was talking to her, and she told me that she has lost 4 pregnancies and 4 babies. They were born, they are born, they die. They're born, they die. Then I was asking her, what are some of the things that contributed? She said, blood group. Very frail and that time she the last one she miscarried was in November last year, 2022. And she was telling me, and she looked pregnant. So she was like, I was operated on, and she even went ahead and said, and the uterus now was removed because it was so that she had been operated on several times, and then this time she was like, it was very light. She told me that the uterus was very light, and it was she was advised to eat all away. So and you could see the pain.
Yes.
Losing 8. That was a lot. I was looking at her and I'm like, this needs a lot of support.
Yes.
And then I asked, does your husband know his blood group? I said, Apana. Imagine with those 8 losses, and even the man does not know.
And what about her blood group herself?
It's negative. It's negative.
Okay.
So I guess the man should be, the father should be positive. Probably.
Yes. It Rhesus isoimmunization, meaning when you already have the antibodies to fight a positive baby. Sometimes, will most of the times make you give you the recurrent pregnancy losses, as we are saying. Basically, you don't have something to show that you actually gave birth to a baby. So, in my opinion, that is where we refer such a patient to a highly specialized gynecologist, what we call the fetal-maternal experts, because they have a way of assessing the blood group of the baby even before we progress even further, where they actually get blood from the baby and get to know, are there any genetic issues with those babies? Maybe that's why you're losing them. What is the blood group? What can we do about it? Because if we find that, as we said, the ones who have already developed antibodies, if we find that you already have them and they are rising, then there are interventions that can be done, whereby, as I was telling you, the transfusions that take place in the uterus to try and push the baby further. So what we are avoiding is the complications of the anemia, leading to the heart failure, leading to the death of the baby, even inside the womb. So the transfusion actually helps to prevent such. But it is not done in just every facility. This is a patient that you would want to refer to what we call a fetal-maternal expert, where this is done. So that we try and push that pregnancy to see whether we can get it to around 34 weeks, because 34 weeks is where we believe the lungs of the baby are good enough and the baby can actually be born and be able to survive after that. So there is still hope. Such a patient would be seen, and it's very unfortunate that actually happens.
Imagine.
Yes. And especially if you're giving birth by cesarean section, there are just enough pregnancies that you can carry. Yes. Right?
Yes.
It's not like the normal.
Yeah.
But it's very
some of them were normal delivery, as she told me.
Okay.
And then some were, it's like they were mixed.
Yeah.
Some yes, some, but 8 babies lost.
Those are many.
Those are very many.
What I would advise is something simple as knowing your blood group,
Mhm.
knowing your husband's blood group.
Mhm.
You might not have this information,
Mhm.
but that is why the healthcare provider is there for you.
Yes.
So once you go to the hospital and I know your blood group negative,
Yes.
and maybe I know what your spouse is,
Mhm.
and it's positive,
Yes.
then I know, because it's part of what we do,
Yeah.
then I know how I should follow you up, right?
Mhm. Mhm.
So it's always good to seek antenatal care in a good facility.
Yeah.
Yes.
Okay.
And for such a patient, I think it would be better if she's followed up by a gynecologist, because then the care would be a little bit different, it's a bit advanced.
Mm.
Yes.
I think we can't overemphasize that, especially the antenatal care,
Yes.
so that the mother is followed up, because our wish is to have this baby,
Yes.
and a bouncing baby,
Yes.
and healthy baby, so that the joy can be full
Yes,
for
sure.
mothers and families.
Yes.
Now, as we come to close, Daktari,
Yes.
we've learned so much, and much more that probably we'll learn later.
Okay.
There are things that you may feel you need to share with our viewers, so that even as we go along in their lives, they may be able to take note of that. You've mentioned quite a number on the way, but probably there's something we need to stress and say, this we need to take care, we need to watch out, we need to look out for this particular.
Antenatal care is very important. Of course, there are many other things that we look at, but because today we are focusing on Rhesus isoimmunization, it would be good for every mother to actually know what her blood group is. It doesn't mean that if you're positive, that's it, that you shouldn't go for follow-up. Yeah. So positive or negative, still antenatal care is good, because at the end of the day, what we want is a good bouncing baby at the end of it all. So if you're negative, then remember there are things we can do to actually protect your baby, especially if your spouse is positive, because there's a high chance that you would be carrying a positive child, Rhesus positive. So remember, your body would form antibodies against the baby's blood. So part of antenatal care is to protect you from developing those antibodies that will later fight your child and will give you issues with other pregnancies that will follow after that. So there's a role of knowing your blood group. There's a role of, if you have any bleeding, then you need to contact your healthcare provider, because you might need to be given the anti-D so that you don't develop the antibodies. Remember, we do what we call the indirect Coombs test. We do it at contact, and we also repeat it again at 28 weeks. If it is negative, it means that you have not formed the antibodies, and you will need to get your anti-D injection. Then you will be given again after delivery, that is after we have checked your baby's blood. If your baby's blood is negative, then there's no worry, you don't need the anti-D. If the baby's blood is positive, that's when now you'll have to get your anti-D within the 72 hours. If it means your ICT is positive, it does not mean that it's doomed for you. No, it means that you just need to be in a highly specialized unit where we can continuously monitor your baby and monitor you also, check whether your baby is developing any complications, and if there are any, then we also intervene. Yes. So I'm stationed at Kiambu Medical Center. It's opposite the level 5 county hospital. My personal line is 0721 264 052. So if you come there and just ask for Dr. Mbuga, then you'll be directed to me.
Yeah.
And karibuni nyote.
And somebody may
Yes.
want probably to text.
Yes.
They may not find you on phone. Probably text would still be okay.
Yes, text is, I think even text is even better, because sometimes you might call and I might be engaged somewhere.
Yes.
So sometimes when you find all these numbers and you have no idea where to start, I think a text would. Try call. If you can't find me, just do a text and I'll reply.
Okay.
Yes.
Asante sana.
Yes.
And I want to take this opportunity to thank you so much. It's such a delight to have you.
Thank you.
We have been following mpaka tumepata leo. And I'm very happy. So I believe that our viewers are able to get this information and even share with other people, so that it's not, they are not selfish.
Yes.
They go out there.
Yes.
And thank you once again.
Thank you.
I can't thank you more.
Thank you so much for having me.
Yes.
And remember, we have said there's nothing wrong with whatever blood group. And as you talked about premarital counseling,
Yes.
even if you discover your wife is negative,
Yes.
please do not get rid of her. There's nothing wrong with her.
Yes.
Yeah, we
True.
just need to take
True.
care of her later.
Yes.
So no, it should not be a reason for not marrying someone
True.
or not conceiving with someone.
Yes.
We always have a plan. We
Yes.
always have some way to take care of that
Yes.
person.
Yes. Thank you for
Yeah.
putting that again out there.
Yes.
Because we might think that now when I get to know this is negative,
It's
sitaki
no
mashida.
go zone. No,
Sitaki mashida.
it's
But
not.
as you said, and you started by saying that
Mm.
no blood group is superior than the other.
Yes.
It's just that we are that way.
Yes.
We are that way by nature, and that is how God created us,
True.
and that is it.
Yes.
Yeah. Our viewer today, thank you for being with us, and continue following us on YouTube, Jane Karaoke, Health Now Show, on Facebook, Health Now Show with Jane Karaoke. And if you'd like to get in touch with us, you can reach us on 0114 404 200, and we'll be able to, you can text us and we'll be able to respond back. You may have a question that you may like to ask the doctor. You can either contact her directly, or you can also text us on that WhatsApp, on that number that I've shared. And until next time, when we bring another expert to take us through our health issues, is bye from us today. And remember, Health Now Show is your health friend. God bless you.